Hello friends. So today's class is on blood vacutainer, also known as the blood vials. So what are these blood vacutainers? So first we'll see how we define them. The definition. So these are sterile, and what are they made up of? Glass or plastic tubes. And what are they used for? To collect and transport blood samples to the respective labs. Okay, so what are these blood vacutainers? Also known as blood vials. What are they? These are sterile. Why? Because you don't want any contamination in your sample. Then what are they made up of? They are made up of glass or plastic. These are glass or plastic tubes. And what are they used for? To collect and transport your blood sample from the point of collection to the respective labs. Now, why is this uh, topic important for us? One, for our practical use. When we are present somewhere, when we are posted somewhere, we have to take samples and send it to respective wards. We need to know which samples are to be taken in which tube. Secondly, this color coding of the samples, this comes in your exam as direct questions. They ask you, they give you a certain test and they ask you in which vial it has to be taken, the sample for it. Okay. So let's proceed to see that how this color coding works and what is the difference between various vials. Okay. So coming to the first one. This is your red vial. This is red top. I'm telling you, all of these are color coded, so you have to remember the color also, and you have to remember why and how they are used. Okay. So plain tubes. This is red top, also called as plain tube. Why plain? Usually it does not have any preservative, no preservative present. Sometimes a clot activator may be present in some tubes. I'll show you, like here it is written that it is a serum tube which has a clot activator. You can see on your screens. Okay. So now you know it is red top, it is called as plain tube, and it may or may not have clot activator. What does it do? It separates your serum from the other blood components. Okay. So now your serum is separated. So what is our next lead? What is its uses? In which test is this tube used? So first is biochemistry panel. Most of the biochemistry tests are to be done in this tube. Okay. What other tests you can do in these tests? In this test tube are therapeutic drug monitoring. What does that mean? There are certain drugs that requires monitoring. Their dose monitoring is required. So whenever you have to find out what levels are they at present in the body of patient, in the circulation of patient, you need to take sample in this tube and then send it to your biochemistry lab. Other test that is used is that it is used in the endocrine disorders. All endocrine disorders, all endocrine disorders except, important is except what? Thyroid. Thyroid test is done in separate tube. Okay. So how do we summarize this? This is red top. We write the color. Additive, usually no additive. Uses, we have seen biochem tests, therapeutic drug monitoring, and endocrine tests. Also, vitamin D is tested in this. Okay. Now, coming back to the next. This is your yellow top. Yellow top or golden top. Okay. So what is the difference between your yellow top and red top? Both are serum separator. This is also known as SST. What is SST? Serum separator tube. This is serum separator tube. Okay. Now what are the tests that are done in this? So we saw that the endocrine tests are done in the red wine. So what is the test left for this? First of all, thyroid. What other test? Hormone panels. All the hormones. Then your growth hormone and ADNA. Then also CRP, and you've heard of CA factors, mostly seen in your ovarian cancer. All of these, and one important is the immunoglobulins. The quantification of immunoglobulins is done in this step too. Okay, so we'll write here our second tube is the yellow top. Yellow top. What does yellow top? What is it called as? Serum separator tube. Why is it called so? Because it has a clot activator, which can be in the form of silica particles. Okay. Or gel separator. What are the tests done? First of all, thyroid. What are the other tests that are done? We have talked about immunoglobulins, gastrin, GH, ADNA. All the hormones that you can remember, all the hormonal panel is done in this tube. Okay. And immunoglobulins we already covered. Right? So we move on to our next vial. Our next vial is orange top. Now, how is orange top different from the previous ones? Orange top has a has something called as thrombin. What is thrombin used for? Thrombin is used to separate serum immediately. Now, what is the word that you would be looking in the question? It is stat or immediate or emergency. All the tests listed for orange, golden top and red top, all those tests can be done by this orange top. But what is the difference? It is used in stat conditions where you just take the sample and you immediately want to process it. So thrombin present in this tube accelerates the clotting mechanism and helps to separate serum faster than that in the other tubes. Okay. So let's summarize it here also. Third is orange top. What does orange has? Thrombin. What the test can have that can be done in this? All of the above. Right? Now coming on to our fourth tube. This is a very well known tube. You must have all come across this. This is your EDTA tube. What does EDTA stand for? Ethylene diamine tetraacetic acid. And write it down for you. Ethylene diamine tetraacetic acid. Now what does EDTA do? EDTA is a chelator. It chelates calcium from your blood. So we all know, what does calcium do? Calcium triggers your coagulation cascade. So if it triggers your coagulation cascade and this calcium is now bound by EDTA, then what will happen? It will block your coagulation cascade. What will that result in? It will work as an anticoagulant, right? So now that it is an anticoagulant, now we have the blood in its actual form. What are the tests that can be done? So the tests are CBC or hemogram as you call it. So your hemogram includes everything, your WBC count, your platelet counts, your hemoglobin, your hematocrit, all of that covered in CBC. What other tests can be done? Blood grouping and your very important HbA1c can be done on EDTA, right? Okay. Now next is your pink tube. Why are we reading this pink tube immediately after this before summarizing? Because these are both sister tubes. These are exactly the same. What is the difference? This pink tube is FDA approved for blood bank testing. Okay. So this is exactly the sister tube of purple top. The only difference is it is used for blood bank testing. What blood bank testing? Whatever blood grouping, cross matching, ICT, BCT, whatever you are doing can be done on this. Right? So now we'll summarize. So what is our purple tube used for? What does purple top has? EDTA. What are the tests it is helping in? CBC, HbA1c and similar tests which require unclotted blood. Okay. And similarly we write for pink also. Pink again contains EDTA and the test it is used for blood bank serology. Okay. Now coming on to our next tube. Now is it visible? This is our grey top tube. Grey top tube. What does it contain? It contains sodium fluoride and potassium oxalate. Sodium fluoride and potassium oxalate. So I'll first tell you the use and then I'll tell you why it is used for it. So you must have seen this is used for sugar estimation. When I say sugar, it is glucose estimation, right? So why a special tube for glucose estimation? So now the blood has been drawn from your body. The metabolism is still going on in that blood, right? The RBCs are continuing with their metabolism. So what is happening? What is the metabolism that is happening inside the RBC? It is glycolysis. Now you know that if glycolysis is happening, that means the glucose is being consumed, right? So if you take it in any other tube, that glucose will continue to be consumed before the test occurs. So from the point of collection of blood to the point of testing, a good fraction of glucose has already been consumed in your glycolysis, and whatever the result of the investigation that we get will be hampered. So this tube was designed. This is grey top tube. It has sodium fluoride, as I told you. What does fluoride does? Fluoride blocks the glycolysis. Once it is able to block the glycolysis, the amount of glucose that was present at the time of collection will exactly be the same, which will be coming in your investigation results. Okay, so you have to remember that it is used for glucose estimation. So this is our sixth tube. This is a gray tube. It contains sodium chloride and it is used for glucose estimation. Right? Now coming on to our next. This is a blue top tube. We have come across this tube also very often. What is important for this? I'll first tell you the use. Why use? It is used for assessing coagulation factors. All the coagulation studies to be done in this tube. So what are the coagulation factors? The coagulation studies: PT, INR, APTT, fibrinogen, D-dimer. You name it, you have it. Okay, whatever, all the factors that are responsible for your coagulation can be tested in this. Now, what does it contain? It contains 3.2% sodium citrate, right? It contains 3.2% sodium citrate. What does this sodium citrate do? It again chelates calcium and stops the coagulation cascade. So whatever amount of substances for coagulation were present at the time of collection will be preserved until the time of investigation. Okay, that is why your this contains sodium citrate and it is used for coagulation studies. And this is your blue top. It contains sodium citrate and is used for coagulation studies. Right? Moving on. Next is green top. So this is easy to remember. This is easy to remember. What does it do? This contains your heparin. This contains heparin. Okay. So you can have two types of tubes, heparin tubes. One is sodium heparin. The other is lithium heparin. Not much difference in any of these, and primarily used for bone marrow studies. All you have to remember about this tube is just this much. This is primarily used for bone marrow studies, right? So what is this? This is green top. What does it have? It has heparin. I told you two types of heparin. And what does it do? It is used for bone marrow studies. Next you can see is the black top. Black top is your golden question. Now we are left with two tubes. As you can see on your screen, this is the black top tube and the white top tube. These are the questions that will put you one step higher from the other candidates if you know the answer. This black top is particularly used for ESR. What type of ESR? The Western green method, right? You just have to remember this much about this tube. So here, this 9th and 10th are the tubes that are going to fetch you marks. Black, what does it have? It again has sodium citrate. What is it used for? It is used for ESR. Okay, and the last one we have is the white tube. So all you have to remember is just see its face. You have to remember this is the white top tube, and what is it used for? White top tube is used for molecular testing. What kind of molecular testing? What is the most common molecular testing that we know? PCR. Just this much you have to remember about this. It is used for PCR studies, or as you say, molecular diagnostics. right? So at the end of the discussion, we now have this table. As you can see, we made this table along our discussion: vial color, additive, and uses. We have mentioned all the colors that you need to know. We know what kind of preservatives are present in each. We know the preservatives, what is the logic behind using that preservative, and what is the logic behind doing test given the preservative present in that particular vial. Okay, so this table is something that this is the take home message from this class. All right, thank you.